the patient's visual acuity with the Snellen chart. Can you please read the smallest possible lines of letters with two eyes?
N, P, X, T, Z, F.
Next, with one eye only and cover the other.
N, P, X, T, Z, F.
Thank you po. With the patient about 2 feet away, ask the patient to focus on the pen light and move the patient's eye through the 6 cardinal positions of gaze. All I want you to do is don't move your head, just use your eyes to watch where the pen light is. By performing this, we will look for any involuntary shaking of the eye. Inspect the external ear bilaterally for shape, size, and lesions. Palpate the ear and mastoid process. Make sure that there are no tenderness and pain. Does it hurt, ma'am?
No.
And mastoid process is here. Does it hurt, ma'am?
No.
Thank you. Perform an otoscopic examination. For an adult, pull the auricle up and back. Okay. Note cerumen, edema, discharge, or foreign bodies and condition of the tympanic membrane. The cranial nerve 8 or vestibulocochlear nerve. Use a whispered voice to test hearing. Stand about 1 to 2 feet away from the patient out of the patient's line of vision. Perform tests on each ear and ask the patient to cover the ear not being tested.
Basketball. Volleyball.
Vestibulocochlear nerve or cranial nerve 8 is intact. Use a tuning fork to perform Weber's test and Ryan's test if the patient's report diminished hearing in either ear. Next is inspect and palpate the external nose. Now, I will inspect and palpate the external nose. Do you feel any pain?
None.
Palpate and lightly percuss over the frontal and maxillary sinuses. Now, I will palpate the frontal and maxillary sinuses. I'm going to put pressure on you and tell me if you feel pain, okay?
Okay.
First is the maxillary sinuses. Do you feel pain? Next is the frontal sinuses. Do you feel any pain?
None.
One nostril externally with a finger while patient breathe through the other. Repeat for the other side. Do you feel pain? Do you feel pain?
No.
The internal nostrils using an otoscope with nasal speculum attachment. Palpate the temporomandibular joint by using your index finger over the front of each ear, and you ask the patient to open and close the mouth. Next is we're gonna palpate the temporomandibular joint by placing your index finger over the front of each ear as you ask the client to open and close the mouth. Please open and close your mouth. And I am feeling for any grating and clicking sensation, and I feel none, so that's good. Next is inspect the lips, oral mucosa, gingiva, hard and soft palate, teeth, and salivary gland openings by asking the patient to open the mouth wide using a tongue blade and pen light. Make sure that the lips are pink in color because whenever the oxygen saturation is low, their lips turn in blue. Lift up your tongue. Look for any lesions underneath the tongue. Also, look around for cavities and broken teeth. And make sure that the uvula is nice and that midline. Next is we're going to test the cranial nerve 9 or the glossopharyngeal nerve. Inspect the tongue. Ask the patient to stick out the tongue. Place a tongue blade on the side of the tongue while patient pushes it to the left and right with the tongue. Inspect the uvula by asking the patient to say ah while sticking out the tongue. Say ah.
Ah.
One more time.
Ah.
Palpate from the forehead to the posterior triangle of the neck for the posterior cervical lymph nodes using the finger pads in slow circular motion. Inspect and palpate in front of the ears and behind the ears, under the chin, and in the anterior triangle for the anterior cervical lymph nodes. Inspect and palpate the left and the right carotid arteries. Only palpate one carotid artery at a time. Use the bell of the stethoscope to auscultate the arteries and tell the client to breathe in and breathe out. Please breathe in and breathe out. Breathe in and breathe out. Thank you. Inspect and palpate the trachea. Make sure to look for any lesions and look for any lumps. And by inspecting it, there are no lesions and there are no lumps. Make sure the trachea is in midline. Do you feel any pain? And I don't feel any lumps or lesions, so that's good. Next is palpate the thyroid gland. Ask the patient to swallow. Look or feel for any lumps or bumps as she swallow. Please swallow again. And I feel no lumps or bumps. That is a good sign for a healthy thyroid gland. Palpate the supraclavicular area. Make sure that there are no lesions or any discharge when palpating the supraclavicular area. Because if the patient feels pain or tenderness, you might have a problem like tuberculosis and histoplasmosis. Do you feel any tenderness or pain?
None.
As for my patient, she did not feel any pain, so that's good. Lastly, document findings in the client record.